Did you know that a sitting leg lift actually requires more strength than a leg press? The seated leg lifts deep dive part 2, form and anatomy. First up is form, how to actually do the exercise. Down on the floor with your legs extended out in front of you. You want to make sure that you're sitting firmly on your ischial tuberosities, your sit bones. Take a moment, make sure that your pelvis is in neutral. Remember, everyone's body is different. Neutral for some people is going to have a little bit more of an arch and the lumbar spine. Neutral for others will have a little bit less of an arch. You want to test to make sure that your pelvis is in neutral. Go ahead and pull up on those lower abdominals. Once you feel that core activation and engagement, you should be stabilized in a relatively neutral position. We're going to bring our hands around our head, lacing our fingers together, and we're going to place our hands a little higher than you would normally expect, just above the occipital area. I actually like to put my thumbs right at the base of that area. Take a moment to make sure your shoulders are connected to the serratus anterior, gently sliding them away from your ears and gliding them just a little bit forward, making sure to maintain that 30-degree scapular line. This means you should be able to see your elbows out of your peripheral vision. Stay nice and heavy on the shoulders, imagining creating space through all of your joints without pushing or forcing. Bend your left knee, bringing the sole of that foot to the inside of your right knee. Line your heel up at the end of your knee so that your foot runs alongside the opposite shin. From here, take a moment, make sure you're maintaining back extension. You can just gently push your head into your hands. That helps with straightening and engagement of that thoracic spine. When you're ready, point the toes, inhale to prepare. On the exhale, core engage. Lift the right leg just an inch or two off the floor. Inhale to lower, and just repeat, moving with your breath. Trying to make sure that you're only moving the leg in its socket, not the pelvis. Inhaling to release, and exhaling, just lifting the leg slightly out of the socket, putting the hip into flexion, making sure to keep the leg parallel, lifting up through the kneecap with the quad engaged. Inhale, lowering. If you need a little bit of additional proprioceptive input to make sure you're maintaining back extension, not tucking or tilting your pelvis, you can sit against a wall or put a foam roller up against your back. Just make sure you don't find yourself leaning against it. We want to make sure to stay active along our posterior as well. Now that you've seen that, I'm going to show you how the hip flexors, deep core, and hamstrings are all working together in this movement. As we lift our leg, our hip flexors are working to concentrically engage, which means engaging as the muscle shortens. That's part of what makes this so difficult. The hip flexors don't generally like to work in a shortened position as it is. At the same time that our hip flexors are shortening as they come up, our hamstrings need to relax and lengthen to allow the hip flexors to continue shortening. While those are simultaneously happening for movement, in terms of stability, our lumbar extensors are working to help keep our pelvis from tucking as we bring our leg up and down, and then our lower abdominals are working to help keep our pelvis from arching or tilting as we bring our leg up and down. If you notice that your pelvis starts to pull forward, tucking into posterior tilt, aside from weak lumbar extensors, this is also caused by having tight hamstrings. Hamstrings connect at our ischial tuberosity, these sit bones, and so what happens is if they are tight, if they're shortened, as soon as we continue to try to lengthen to get those to relax, what's going to happen is the pelvis is going to likely pull forward. If you notice the reverse, that your pelvis is tilting, more of an anterior tilt when you do this, that may also be a sign of weak hip flexors. The body's going to try to naturally shorten that space, which it's going to do by arching the low back, tilting the pelvis, instead of actually using the hip flexors and bringing the leg closer to the chest. And yes, you can experience all of these things at once. You can have weak lumbar extensors, weak lower abdominals, weak hip flexors, and tight hamstrings, like me. Because of my sway back posture, these are all very common. So this move in particular is quite challenging for me. And with that, I will see you back here for part 3, which is going to be modifications and adjustments. Help for people with tight hamstrings.